Hello. Happy Thanksgiving, everybody. I hope everybody's having a good day, enjoying time with your family. And my name is Dominic DeBellis, and today I'm going to be discussing one of the most pressing issues of our society, the cost of healthcare in the country we live in. And the title for my presentation is The Cost of Healthcare, First World Country, First World Crisis. Now, I want to go ahead and take a look with you guys why it's time for a change in that. We often think of the United States that we live in. It's the land of the free, the place where opportunities and possibilities are completely endless, that anybody from anywhere can come make a life here on the American dream. But for about 45% of Americans, access to affordable healthcare is a major roadblock that prevents them from having a great life. A 2024 survey found that nearly half of U.S. adults are struggling with their medical bills, and many of them are avoiding seeking necessary health care due to the cost. Unfortunately, this crisis is not only a financial issue but also a moral one. And today I'll explain how healthcare could be the solution. Let's look, excuse me, let's break down the problem. As I mentioned, 45% of us American adults report difficulty covering our medical bills, right? And even more concerning, 72.2 million Americans us avoid necessary health care because they simply cannot afford it. I can't even imagine. This situation is unsustainable and puts our society's well-being at risk. So how did we get here, and what can be done about it? The idea of universal health care isn't new. It dates back to 1912 when President Theodore Roosevelt called for health insurance for industrial workers. For example, like if you got injured at work, they were liable to cover and help you out, paying for your injury and help and care. And fast forward to recently, the Affordable Care Act passed in 2010, which expanded healthcare access to millions of uninsured Americans, which was orchestrated by the Obama administration. Yet, even with all these advances, we still have a long way to go before we can say all Americans have access to the healthcare they need. Universal healthcare isn't just about access to doctors and hospitals. It's about creating safer, healthier communities. With universal healthcare, we can make basic necessities like the food we eat, feminine hygiene products, tampons and pads, and baby formula affordable for everyone. This would reduce crime driven by desperation. And as Khalil Kamboy pointed out, when people cannot afford basic needs, they turn to theft to survive. Providing healthcare care that covers these essentials could help break this cycle. Universal healthcare would also have a profound impact on women's health. Currently, millions of women in the United States cannot afford basic menstrual hygiene products. Insane, right? And this issue, known as poverty, affects about 22 million women in the United States. By providing these products for free, we would alleviate financial stress from women, and specifically women in low income and single parent households, enabling them to focus on their health. And with universal healthcare, we can ensure all women have access to essential cancer screenings as well, which could help save lives and improve health outcomes by identifying cancer sooner. Now, let's talk about mental health. Our country, unfortunately, is facing a mental health crisis. It's tied to the issue of homelessness. Over 6,500,000 Americans were homeless in 2023, with a significant portion struggling with mental illness or addiction. Universal health care would provide the mental health services and addiction treatment necessary to help these individuals out and help them get back on their feet. This is not just about compassion. It's about creating a healthier society for everyone. Many of these people on the street often just need that hand to get back on their feet and continue contributing to the United States. Some people might argue that universal health care will increase taxes. Well, unfortunately, that is true. That's inevitable. I don't think we could have ever tackled this issue without acknowledging that. But I want to look outside the USA. I want to look to a country that already has universal health care. And for this example, I chose Sweden. And because of this, they fund their health care like we would in the future through their taxes. And Sweden as a country ranks high and like really high in happiness and low in healthcare stress. But all in all, the main point I wanted to make is a small increase in taxes can create a more equitable and healthy America. When we alleviate the stress and concern about just going to simple doctor's visit for our kids, loved ones, or families, we have produced more healthy Americans ready to work and provide for our community. In conclusion, universal health care is a human right. That's we should all have, and I feel like as the United States, it's time for us to make this stepping forward, and make it a reality for all of us. No one should have to worry about how they're going to be able to pay for their son to get cancer treatment or their mom hospice care in the last moments of her life. So, by providing access to healthcare for all, we'll help reduce crime, poverty, and help improve all Americans' well-being. So, I urge you guys, anybody listening to this, to make the changes in our country. It can start small, just like state voting, regional voting, and even presidential voting. I urge you to look into what can help our country tackle this issue the best. All right, my name is Dominic DeBellis, and thank you so much for listening to me. And I hope you guys make a change that we need in our world.